Hi everyone, it's Dr. Latowski. Can everyone hear me? Audio is great. All right. Yes. Thank you guys. Thank you everyone so much for joining us for this webinar. This is the most important webinar of the year, in my opinion. Why? Twofold. Because this webinar is going to give you an offer on what is probably our most important, greatest one treatment procedure. The second thing is we're going to offer you a value that is so worthwhile and so valuable. We're giving you our biggest promotion of the year. So I'm really excited that you tuned in today. And if you are looking for a holiday gift for yourself or a birthday gift for yourself or just something wonderful to do for yourself, I am really excited for you to hear this webinar and see what you think. All right, so let's get started. We are discussing my favorite treatment today, the Fraxel Laser. This is something that I personally have done to myself at least once a year. I'm trying for twice a year. I'm probably at once a year the last couple of years. But look at our beautiful, beautiful marketer, Heather, here in this photo. Um, she is so gorgeous. If you look on the left, her before picture, you look and you see that she's already so beautiful. You don't look at her skin and think she needs something done. But look after one treatment on the right, that's just several weeks after one treatment, you can see the dramatic improvement in her face, neck, and chest just several weeks afterwards. And as we'll discuss, the effects of the treatment continue to improve over time. All right, and now let's get down to business here. This is what you're going to automatically be qualified to win by attending this webinar. So thank you to everybody on this webinar. You are automatically entered to get this wonderful raffles valued at $120. And these Skin Medica Insta Bright eye masks are everything, you guys. These things really are so relaxing and they calm down any puffiness. And if you get any puffiness around allergy season, they really help with that. And the exfoliating cleanser is one of our favorite products. And of course, the Instant Bright Eye Cream is really great at slowing down the crinkles around the eyes. So this is a really awesome giveaway. And I wish you guys could all win, but congratulations to the future winner of that one, because that's like a really, really great product line. So why would you be interested in this technology when now we have invested in several technologies to offer you? So like I said, this is one of my favorite devices and technologies. This device was pioneered over 19 years ago. So we have experience. And there are lots of copycats out there. And copycat, I'm saying that as not necessarily a negative thing, but this is the gold standard. So there are competitors out there that do something similar, and there are many great competitors out there. But this was the very first, the gold standard. I trained with this right when it was released. So I trained with this in my residency program 15 or so years ago. And I worked extensively with this Fraxel device in my fellowship year in Boston. And it's just really, really come a long way. We know how to, the most effective way to use it. Those 19 years have really allowed us to hone in and make it as effective and as safe as possible. And those are the two things that I really look at before adding a device to the clinic is it safe and is it effective? Um, so it's also a one-of-a-kind, non-ablative, fractional technology. So there are several types of lasers, but a lot of times in laser terms, we talk about ablative technology and non-ablative technology. So this is non-ablative, which basically means it's gentler than a CO2 laser. So if anyone's had a CO2 laser, you know that that treatment can be quite harsh, lots of downtime. This is gentler than a CO2 laser. There are over 1 million treatments that have been performed with this laser. So, again, we're talking about safety here. We're talking about knowledge about the technology, and we're talking about results. So, the fact that we have so many people who have been treated with this device, it contributes to all of those factors, and it makes me feel really confident about what we can offer you with this device. And then, of course, as you all know, I am very passionate about showing me the evidence that this is going to work. I'm not just going to take something at face value. I want to see evidence. I want to see clinical trials. I want to advance the field of medicine by performing clinical trials. And this device has it all. So there's actually over 50 published clinical trials with the Fraxel laser, which has resulted in improvement of the laser field tremendously, and also, of course, improvement of this technology for you, the patient. So, what is this Fraxel? What the heck am I talking about? The Fraxel laser is minimally invasive. It is considered skin resurfacing. So, it's a fractionated erbium non ablative laser. And what happens is it uses these little microscopic laser columns. So, it treats the skin in what can be described as a pixelated way. So, it treats this microscopic column of skin, and it leaves the next microscopic column untreated. The untreated skin provides the healing cells. And so the healing cells don't have to migrate very far. So they jump to the treated skin. Your skin heals very quickly and safely. Those healing cells don't get lost along the way, they know exactly where to go. And that allows us to do a pretty aggressive treatment, but that will give us great results, but do so safely and with a minimal amount of healing time. So this dual Fraxel laser, they call it dual because we have two wavelengths, and that allows this treatment to be extremely customizable. So when you come in for a consultation, I will discuss with you your goals. I will look at your skin, look at the health of your skin, see what we need to improve, and we can customize the treatment to do exactly what we're hoping to what targeted towards the results we're hoping to achieve. So sometimes that means treating one part of the face with one wavelength and another part of the face with another wavelength. And so, or sometimes that means doing one treatment with a single wavelength and the next treatment with another wavelength. Or it could mean treating the face with one wavelength and treating the neck with another wavelength. So the combinations are numerous and it's extremely customizable, which I think is really important because, as you know, everyone's skin is different. All right. One of the ways that Fraxel works is to produce new collagen. So, anti aging, in many senses, is all about producing new collagen and elastin. So, these two things really contribute to the health and youthfulness of the skin. So when I was looking at purchasing the Fraxel, like I said, I had used this device years and years ago in training, and I thought, surely there's got to be something different and better out there that will stimulate collagen. So I did my due diligence. I did a bunch of research, read clinical trials, talked to my colleagues, and in my opinion, Fraxel is probably the most effective way to stimulate collagen, especially with one treatment. So that's kind of the mechanism behind all this improvement. It's going to give you new collagen, which leads to youthfulness of the skin. So collagen lives underneath the top layer of the skin. It leads to the tightness of the skin. It leads to the healthiness of the skin, as well as its partner elastin. And so, treatment of the Fraxel is really going to encourage remodeling of the collagen. So, turning the collagen, making it age backwards, basically, and also producing brand new collagen. So, when you age, your genetics determine how quickly you age. Your sun damage contributes how quickly you age, and of course, your actual number age will lead to all those things on the right. So, genetics we can't do much about, but we can. I tell patients it's useful to know what your genetics are, so we can know what's coming and we can do things to prevent those changes. As well, we can reverse the sun damage and we can even turn back the clock with the age related collagen loss by putting the collagen back in, reforming the collagen and stimulating the collagen with treatments like Fraxel. So, what does that translate into? A bright complexion, a youthful appearance. Your skin will look smoother, fresher, it will look younger. Um, so it is effective at reducing fine lines, wrinkles, sunspots, acne scars, and hyperpigmentation. That is a lot of conditions for just one device and one treatment to do. And when I say one treatment, I'm not saying that you should only do one treatment and never come back. A lot of times one treatment will make a significant difference, but there's really no upper limit of treatment that you can have. So for my acne scar patients, a lot of times I'm recommending 3 to 6 treatments, and we may just spot treat in the acne scar areas. That makes it more economical and it makes the downtime less. But the more you do this treatment, the better your skin looks. That's why I try to do mine at least once a year. I'd like to do it more often, um, but sometimes just the time and the timing gets in the way. Um, but I will tell you, I don't do too much to my skin. I use, of course, medical grade products. Um, and I do, some neuromodulator like Botox or Dysport, and every once in a while, some filler or Sculptra. But I will tell you, Fraxel is what I'm most consistent at. And I've had people tell me that my skin looks better than it did 10 years ago. So here's those little microscopic columns I talked about earlier, and you can see it leaves some skin in between that's untreated, and that's where the healing cells are coming from. And that's part of what makes this so safe. And so again, Fraxel was the first technology that really offered this type of treatment. And so we see these really great results that are being delivered very safely. So there's me getting my Fraxel, and you can see we have mapped out where I think that's Emily. Emily, our PA, our wonderful PA at the office, is treating me that time several years ago. We marked out different areas for the different wavelengths, and we treated my face and my neck at that particular moment. And I have, of course, had my chest treated as well. So, what we do is we apply numbing cream. We apply numbing cream for an hour to an hour and a half before the treatment. And that eliminates any need for numbing injections. Some people will prefer to take like a Valium if they can get a driver that they know to take them home. So we can prescribe Valium, but most people, 9 out of 10 people, don't feel like they need it. Um, The Fraxel there's a little tube on it. If you see that clear plastic tube attached to the laser, that is called a Zimmer, and it blows really cold air as we're doing the treatment, and that helps make the treatment more comfortable. And the treatment basically feels hot. It feels like someone's taking a hot roller and rolling it across your skin. Um, it does get hotter throughout the treatment. However, the treatment goes really quickly. The numbing is really the longest part. The treatment itself can be done very quickly, as you'll see in our live demo in a few minutes. Afterwards, you feel like you have sunburn. You feel very hot and very puffy. You don't really feel pain, but sometimes the swelling and the heat is a little uncomfortable, but that starts getting better essentially right away after the treatment. So downtime is about 1 week for the face, a little bit longer for the neck, and probably about 2 weeks for the chest. So the first few days, you will be really red and puffy, most noticeable on the face. On the neck and chest, don't really notice the redness or puffiness. Um, and then, depending on the wavelength, you will have some peeling. If it's the more superficial wavelength, you have peeling. If it's a deeper wavelength, you don't really have that much peeling. But usually, the peeling, if you are going to have some, occurs on day 4 through 7 on the face. So, again, about a 1 week downtime. First few days, red and puffy, and the last 4 days or so, peeling. Here's an example. So we did this before. You can see the brown spots and the starting of the texture changes. Patient had her face treated. 48 hours, you can see the face is red and slightly brown as well. That starts peeling off day 4. We took a picture on day 5. You can see the peeling. Underneath, there's fresh skin. And on day 7, we just took this photo on day 19, but day 7, usually all that peeling is off, or if there's still some, it's minimal. And look how fresh her skin looks afterwards. Look at the improvement in texture. Look at the smoothness. And I think we posted actually this day 19 photo just to let some of the swelling go down, because sometimes when there's swelling, the skin actually looks, some of the wrinkles go away because of the swelling. So we wanted to let the swelling go down. So this is day 19 when the swelling goes down. I'm going to pause for a couple of questions. One says, I had an esthetician went to do a Fraxel laser without numbing cream. Is that possible? I think if he or she was going to do a Fraxel laser, they might just be calling it Fraxel, but this might be one of the competitors that are lower powered, or there is another device. It's called a Clear and Brilliant, and I call it a puppy dog Fraxel because it is the same wavelengths as the Fraxel, but it's a different device because the power is much lower. And you can do that without numbing cream. In our practice, we do use numbing cream because it's a lot more comfortable. But if someone was going to do a Fraxel without numbing cream, I don't think it's this actual device. It's not the actual gold standard Fraxel, because that would be very difficult to sit through. And then someone else, Melinda asked, can a session be scheduled for hands only? Yes, it can. We treat the hands a lot. And I am actually going to show you a picture of someone who just had one treatment on their hands. Here's an example of the chest. And again, the chest takes a little bit longer to heal. Face heals fastest for anything on the body, but you can see not too bad if you have the peeling type of wavelength. And if you have the deeper wavelength, the downtime is even less than that. Marlene, 75 is not too old, definitely. I would love to talk to you about the Fraxel, because I actually don't think there's any age that's too old for this. And I feel like I'm trying to think of my oldest number in terms of chronological years. My oldest patient I've done the Fraxel on, I'm sure She was in her 80s. It may have been almost 90 years old. So you're never too old for these treatments. Okay, so this is Nadia, our lead esthetician, and she is so detail oriented. She took us on a journey with her Fraxel treatment. So Nadia is so beautiful, and she looks much younger than her years, but she wanted to do something for maintenance, and she also wanted to treat her melasma or discoloration on her face. So I treated her with the 1927 wavelength. That's the more superficial wavelength, and you can see day 2, she's reddish and brown, she's puffy. Day 4, here's the peeling. So she is peeling. You can start to see that fresh skin coming through. Here's day 5. She's still puffy. And look, she's starting to have really healthy, glowing skin. This is obviously without any makeup. And here's day 6. She's look at that glow she has on her skin. She's looking really great. You can still see some spots that need to peel off. And here's day 8. Look at the glow in her skin. She just looks great. Look at her overall face, and then the close up. You can see the texture is just super fresh, super smooth. And you can see in this journey, it's been totally worth it, because here she is a week later and she looks amazing, and her skin has permanently changed for the better. So, how many treatments do you need, or what's our strategy? It's so individualized that I would love to see you for a consultation. So, here's a cheesy photo of myself um, giving you a consultation. So, if you're not sure, we can talk about it. And if you are pretty sure you want to do the treatment, you can commit to it, and I will explain everything before we'll come up with a strategy before you do this treatment. The post treatment plan, I make it very easy for you. I give you a packet that I have written myself about how to heal afterwards, and we give you all the products you need. These are products I've selected for you based on research. They will speed up the healing process, and they will also um, enhance the healing process so you form more collagen than you would left to your own terms. Um, and we do need you to avoid the sun before and after treatment. Do not do this the day you come home from Hawaii or from the beach, etc. So a few pictures, just I like this one because it's very close up and you can see the improvement and the pigmentation, the texture, and the overall just health of the skin. Sometimes it's even hard to describe because it's just the overall health of the skin. Here's someone we were treating some scarring and some texture. This is after one treatment. You can see not only is the scarring and texture better, but look how she just glows afterwards. She looks so good. Same patient. I know the angles are slightly off, but you can, and unfortunately she's smiling in one and not in the other, but you can get the kind of sense of how much the skin has improved after a single treatment. Here's another patient. She also had Botox, so disregard those lines on her forehead. That's from the Botox. But if you look at the pigmentation, look how much is improved. And then those lower lines on her face, obviously we don't Botox those. So those have become more superficial over time, and that is from the Fraxel itself. Here's an improvement in texture. So she looks amazing after a single treatment. Look at that, how beautiful that texture just tightened up. And then on this side, we've got improvement. I'm not sure if this is the same patient or not, but for this patient, we have improvement of the discoloration, and we have really nice improvement of the pigment, and really nice skin tightening as well after one treatment. Like I said, you can continue to do more treatments. You will get more and more improvement with each treatment. This is my lovely husband. Um, I first did a Fraxel for him when I was in fellowship actually in residency. So 2007, 2008, somewhere in that time frame. And we never did another one and until a couple years ago. So this is from him a couple years ago from one single treatment. And I wish I could enlarge this photo for you, but if you can see, he has improvement in the lines around his eyes, the subtle crow feet. He's got improvement of his pigmentation. You can especially see that on his forehead and his temple area. He has some scarring on his temples that improved after a single well, it's actually technically a second treatment, but a single treatment in the last 10 years or so. And then just look at the glow in his skin from before and after. You can just see, again, that unquantifiable change where it just looks healthier and it just glows afterwards. Here's um, here's a male who have come in. He actually saw my husband when my husband was healing, and so he came to me and had it done. You can see after one treatment, dramatic improvement of the discoloration. Look at his forehead before and after. Look at the lines. There's been no Botox used. He also has precancers. Those arrows are pointing to those red spots. Those are precancers. And this device, the superficial wavelength, actually has an FDA approval for treating precancers. Now, insurance will not cover this, but I want you to know if you get this procedure done with this device, it will improve the health of your skin, including the precancerous changes, taking care of the sun damage. So not only in an aesthetic way, but a medical way as well. This lovely woman used to work for me. She had perfect skin to begin with because she was very conscientious about her skin. So you kind of think in the left, how could her skin even improve? But yeah, in the right, you can see just overall the health of the skin is improved. So this can be done even if you have great skin. And she just looks great and she was thrilled with her results. So sometimes it's even better in person. Here's a gentleman. We treated his entire scalp for his precancers, and also, of course, the aesthetic results. But we also treated his face, and you can see the improvement of the texture, the glow of his skin, and of course, the discoloration. Here's a close up. You can see the texture and the scarring improvement after a single session. Here's the hand picture. So this is one treatment. I got to tell you, this woman is a fabulous healer, and she really is a great patient. She does her healing process really well. But look at that change after one treatment. And this picture was taken several months out, the after picture. So if I would have taken the picture like 1 week after treatment or several days after treatment, we might have just wondered if some of these changes were from swelling. But this was actually, I can't remember exactly, but I want to say like 4 weeks or 6 weeks after we treated her hands. So she really great results. And I had my hands treated last year and I was really happy with, and even you guys surprised with how much the texture of my hands improved. Here is our deal. This is the best deal of the year, you guys. Purchase one Fraxel for your face and you can treat your chest at no additional cost. You are saving $1,550. So I really want you to have this treatment. I have patients who do this for precancerous and aesthetic, medical reasons, aesthetic reasons. Everyone can benefit from this treatment. The caveat is we've got to do the face and chest at the same time. But you'll see today it's very easy and quick to do the chest. I'm going to demo that for you in a few minutes here. This is a great deal. No, that does not include the neck. The neck can be added on for $800. You can also combine this treatment with other things at the same time. So later this month, I'm going to do a webinar on our newest device, the Agnes. You can see the skin tightening from the Agnes. So Agnes will work to really saran wrap, suction cup, tighten the skin. You can combine it with that. So sometimes people want to do the face with the Fraxel, the neck with the Agnes, or vice versa. We can absolutely do that. Or sculpt dry, you can see on the right, that's after a little bit of sculpt dry. You look at that improvement in the skin texture and the lift that this patient has gotten, not only where the arrows are, but also look at her cheeks and how her cheeks have gone back to normal. So we can combine these treatments and we can do them same session if you would like to, save you some time, some downtime, etc. Lauren, it's your question is my 26-year-old just has acne scars. So if we do the full face, it's $1,550. Um, and if someone has a focal area, for instance, if you just have like a area on the cheeks that has scarring, to spot treat the cheeks, to do the full cheeks is $850. So we try to make it as economical as possible, or cost effective, I should say. It's an expensive treatment. It's very expensive. This laser is very expensive. Um, it took me many years to buy it because it's so expensive and the overhead's very expensive, but you guys, it is worth it. So thank you for considering it. Okay, so here is well, I told you the promo. Here's how you take advantage of it. Give me one moment while we just set up, and I am going to treat chest today. You can see how easy and quick treating the chest is. Face takes a little bit longer because there's all those curves on the face, and sometimes I'm just adjusting the laser and the wavelengths, etc. But I'm excited for you to see this demo. Give me one moment to set up for it. Just give me a thumbs up when you're ready. All right, guys. Hi. We're back. Can someone verify that you can hear me, please? Give me a thumbs up. You guys hear me? All right. Cool. Thank you guys for hanging in there. We were just switching over technologies. So we are treating my lovely staff member today on her chest. Thank you, Jenna, for volunteering. So this, like I said, worked for pigment, texture, creepiness. You can see that I marked out her chest here with some white pencil. I'm going to get this little Adam's apple area because number one, this is an area where people can get skin cancers actually. Because think about the way our clothing falls. We get a lot of sun right in this little nook right here. As well, we're going to go after some of this pigment here. We're going to go after this little like skin texture change. And then a lot of us like to have this little décolleté area treated here just because over time that tends to get a little creasy. And so I'm going to target that area as well. I have the settings put in and we are ready to go. So I'm going to turn on this cooling device that will make her a lot more comfortable. As I'm treating, it's kind of loud, but you'll see how quickly I can do this treatment. All right, great. So here we go. You ready? Feel okay? So here we go. And you can see I can do this very efficiently. This is so worth it, you guys. I am so excited for Jenna to have this improvement in skin texture and tone. And Marcus, I know it's loud, but can you read me if there's any questions that I haven't answered and I can just try to answer some of them? Mm-hmm.
None yet.
What's that?
None yet. Nothing yet.
Well, there's some from the, can you see some from the webinar or not really? Okay, if you can.
Let me see if we go back to
All right, great job. Doing okay? Mm-hmm. So you can see, once the numbing's been done and the preparation is done, that's the hardest part. And then the treatment itself goes very quickly. And it's extremely hot, but if I just kind of move efficiently, so we can just make it as comfortable as possible to her, it's really not that bad. So we are already halfway done with her chest. Pull down and make it flat. You okay? Not too much pressure? No? Good.
So there's one question. Can you spot treat the face and how is pricing determined for that?
Yes. I can absolutely spot treat the face. And the pricing is dependent on how big the area is. So the overhead has to do with the tips and how much of the tip that we use. And so the more area, the more the overhead is. And so that's what really matters when it comes to pricing. So I'm happy to have a consultation and be able to quote you. Or even if you want to email in the cosmetics line, and I can probably even give you like a ballpark from the cosmetic line. You can text a picture. You can probably best to email a picture that's more, and don't include any identifying information. We just want it to be HIPAA compliant, or just come in for a consultation. There we go. All right, guys, that's it. Easy, right? Very easy. Awesome. All right, and she is going to have permanent change to her skin texture change that is going to be long lasting, and it's really great. So thank you guys for tuning in.